reforms in health. Mr. President of the Chamber, dear guests, thank you for the invitation in this conference, which is a well-established institution for the health sector. Ladies and gentlemen, I'm going to speak as the president of the committee that deals with the reform of the health status, and also under the hat of the network, as the president of the network, DIKTIO, which deals with the digital transformation of the state in all aspects. When we speak about social state, we speak about all the sectors like education, health, social policy, integration of minorities, etc. Health is one of the major discussions in Europe and in Greece as well. Everything changes in the economy nowadays. The economy cannot function in the way that it used to. New needs are here. People have new needs due to the wars, due to the energy crisis, due to the difficulties that people face in their daily life. Let me say that my team works under 4 major mega trends that influence the social state, and their impacts have to be dealt with via different policies. Digital change, climate change, the demographics throughout Europe, and number 4, the changes in the labor market. This is also something to deal with throughout the industrial sectors and the pharmaceutical industry. The mixed new professions and the new skills necessary. We are going to consume these to conclude our work in 2023, and we're going to publish it. The catalyst for all the systems is the digital transformation. And of course, the health sector is one of the most important systems of a social state, where digital transformation means that we have more and better services for the citizens on a personalized way at a lower cost. Let me share with you first what goes on in Europe as regards to digital health. We know that health is under the portfolio of governments, but for several years now, the health services of the European Commission, in cooperation with the member states, provide suggestions. And of course, we have a lot of European programs that provide funding. From the previous decade, we started preparing ourselves for digital health in Europe, mainly focusing on the matter of on stock-taking data in the hospitals, utilizing this data for research and managing the scheme. The most recent program at the European level is EU4Health. It is a program that has been established by means of a regulation. It has as its first priority everything that regards digital systems, the support of health data, digital tools, and digital transformation practices. The European Regional Program of the World Health Organization in last September, set as its first priority the digital transformation of the health sector. Essentially, the utilization of the tools of the fourth industrial revolution to the benefit of health. Of course, you understand that my references are very brief. We have to understand that the fourth revolution is a priority for the health sector, which accelerates day after day, and we can't stay behind. The innovation that you mentioned and the challenges that we face in this area can be seen in many European countries. Europe has many innovations and many innovators. The Innovation awards given every year in the industries are given mainly to health initiatives. The new scientists that receive the awards present new methods or services for health issues. What is important is that these startups or the small companies or ideas do not expand on European territory, but they go to countries where the systems are more flexible. So there they can transform the startup into a big business that produces products. The last thing to say on the European Union work is that well, there are many differences, of course, in between the states, but cooperation and collaboration helps all member states. Europe can provide can showcase the better health systems on the planet, which cooperate with major academic and research institutes. Finland, for example, has film data which licenses metadata for research on health issues. This is from, of course, from drug research, but yet it hasn't been regulated at a European level. GDPR is a global regulatory framework for data. Europe was the leader in safe cross-border verification of personal health data via the COVID experience. Given the fact that 700 million of COVID certificates, were produced during the pandemic. Also, the Resilience Fund and the Recovery Fund has two major priorities for all countries: climate change and digital change. All the programs in all countries have to fall into these two categories, and that's where the money will be channeled. So at the European level, we do have the examples, we have the suggestions and recommendations, and we have the cooperation in between the countries, and now we have the funding. As regards our agenda and the national health system and its challenges, let me say that an initial starting point is that digital transformation, or broadly the fourth industrial revolution in the health sector, is considered by experts as a very beneficial move because it combines many technologies, robotics, algorithms, artificial intelligence, genetics, molecular biology, nanotechnology, 3D printing for all parts of the body, bones, capillaries, etc. And it covers the whole spectrum of people's lives, well-being, because you know that we can have mobile apps to improve our well-being, our daily life, diagnosis, treatment, and rehabilitation. So the digital aids are horizontal for digital transformation. I have chosen today, as in my recent lectures, talks, to focus on some examples. It is important to show examples because that's why we understand how much pilot actions can help us. The ANASA, the Breathe initiative that was presented this morning, is one of such initiatives which can be generalized when we understand how important it is to decrease cost, to facilitate medical professionals, and to understand how big is the benefit for patients. As Mr. Diamantopoulou said, I'm going to speak about an example in Hungary. In Hungary, they use an application where they can scan their skin, photograph it, and send it to the hospital. After 4 days, they get a reply, a response, and in 1 year they had 22,000 cases. Most were very simple ones, so the person doesn't need to visit the hospital or even the doctor. While on the other hand, many important cancers have been diagnosed or at the initial or the more developed stages. So the people managed to take measures. Also, cough. Via mobile applications, one can understand whether the cough means that there is a bronchitis or maybe cancer as well or nothing. So we can understand from coughing the situation of the patient's patient's health. So we hope at the primary or the secondary level of healthcare, we shall see this kind of technological applications that can decipher the cough's signals, or even the voices signals that can showcase the commencement of Alzheimer's disease. Let me also mention another example from the UK, United Kingdom, where a person can utilize a stick and in order to examine their urine samples, and via a mobile application they can understand which are their indicators. 2,000 British citizens used this application. After that, we saw an increase of 72% of those patients that in the past did not go to visit their doctors or take a checkup frequently. 10% showed a high percent of protein in urine, so this could lead to some kidney problems in the future. So this is another example showing low cost with an efficient application and a better life. At the same time, we see the everyday life in the hospitals or in the laboratories, because the laboratories are going to function, to operate in a different manner after the digital transformation. Let me give you another example from Estonia, which has a very developed digital system. Since 2008, all Estonian citizens have disclosed their medical data, and there are medical folders. The doctors upload all data, and the medical files include all types of information for every patient: their allergies, their doctor visits, their prescriptions, everything. Estonia is focusing now on the matter of dealing with data safety. Of course, data have to be utilized anonymously, of course, for research. But security issues are always important. In 1997, Estonia's systems were hacked by Russian invaders, so they have built very strong firewalls. I shared these examples with you because I wanted to show you that these major changes that are anteport us have to be welcomed by our systems. We have to understand the significance of these changes and generalize them by absorbing them. We are at a unique point in the history of medicine. We can see a shift of investments and a shift of the model of providing care to patients. Instead of the patient going to the hospital, the patient can stay at home. We can utilize technology. We can employ AI in order to understand the medical profile of the personal problems, issues of every citizen. and provide medical diagnosis and care. And I'm going to mention one last thing regarding Greece, the Greek system. Digital health is a matter of health policy and not an IT policy. IT is here to support health. So health reform is what is most important here. The challenge is for us, in order to have, as a country, to make the leapfrog and maybe make the Puma leap, in order to cover the weaknesses and enter the new era. The challenges are first to absorb all these new initiatives and include them in our regulatory system. We need a timeline. We need a budgeting scheme. And I remind you here that the Recovery Fund supports these kinds of initiatives exactly as the minister mentioned. In my visit in Korea recently, I worked with the Fourth Industrial Revolution Committee that they have. In 2017, they had presented the targets for 2021. They had 2 pilot hospitals in 2017 where they monitored all the information, and their aim was that in 2022, all the hospitals in the country could be connected via this platform. They managed to do that earlier than their target time. Another challenge is to increase digital skills of the medical personnel, people in the hospitals and the private practices. This is indeed difficult due to the fact that we don't have enough personnel, and the people are very tired due to the high loads of work. This is going to be a serious challenge. And the last one is the design of initiative employment actions. Having an application doesn't mean that you can implement it on the next day. This must be simple. It must be efficient. It must be able to enter the existing system, and it must be able to answer to specific needs of the people. Data management is another important challenge. Interoperability of the system is a major problem in Greece because organizations, ministries, hospitals, bodies have to be connected with each other because they have to utilize the same information systems. Accountability is going to change. Ethical issues are going to rise even more seriously. And of course, the labor market is going to be affected. We're going to have to see crisis in some areas and new opportunities in other areas. Of course, no change can bring about benefits if it's not embraced by all the stakeholders. In health, all of us are stakeholders in Greece. So the citizens have to be able to utilize all the services that we're going to provide. And here the Recovery Fund provides funding for digital literacy of the people. However, in order to be frank and realistic, I can say that we cannot have a digital oasis of health, even if we had the ideal hospitals and the ideal policies, because we have many serious digital gaps in the society. Despite the applications that we see, our country is ranking 26th in the 28 European countries in digital indicators. Ladies and gentlemen, the question is, can we make this leap based on our today's situation, or should we accelerate? The answer is that we have seen examples of countries that have had much more serious problems, as Estonia, for example, which in 1999 has 800% of inflation, and it was under the Russian mafia. but they managed to be first in the world because they adopted a culture and they had the leadership to forward the society towards a specific future. Thank you very